Well. Welcome, everyone. I think we got everything set up in the studio, right? I got to adjust some volume here because people on YouTube don't hear me. For those of you that don't understand how all this stuff works, how I have the studio set up, I'm trying to make sure there's not feedback so that you aren't getting a echo or a real nasty sound. Hey, I will say one day, man, we're gonna have a nice studio one day. But for now, I want to welcome all of you back to another episode of Amp Life Talk Radio, a show for amputees and those affected by limb loss. I am your host, Sean Harrison. I am so glad you could join me for another episode. I am starting a little early for most of you that don't realize that I'm actually on a little bit early. Uh, I felt we needed to start a little bit early because I needed to do some housekeeping and take care of some things that just needed to be done. So I'm on a little bit early before we actually get into the show. Um, I want to actually take care of some things because there have been a lot of things going on in my little life here that I like keeping you guys up to speed with everything that I do and everything that happens on the show. So I always try to make sure you're a part of everything uh, that goes on in my crazy life because it does get crazy sometime for me and everything that I do. Well, guys, first off, work has been keeping me very busy. I was in Nashville for a week, traveling with my company, and been doing a lot of different things there. So a lot of things have been transpiring and going down, and I want to make sure that you guys are all caught up and brought up to speed. As some of you can see on YouTube, I'm trying to find that right angle for the camera. My head's so big it takes up the whole thing when I look at YouTube. So, um, and I guess what I have to say is this: I had a unique person scheduled for my show, and I was unable to get home from work in Sacramento to have him on the podcast, and I am so sorry that we missed each other and I was not able to get to you. And since then, I have been running crazy. I shot you an email, and I'm not going to say your name on air, but I will reach out to you, and I would love to try and get you rescheduled to be on the show. If you can find a place in your heart to forgive me and come back on the show and let everybody hear your story, I would really appreciate that. One day I'm going to have, a team of people helping me out, do all the crazy things that I have to get done here. Um, so my apologies to you, and I am so sorry for not being able to get back to you. And as I said, it has been very, very hectic at work. A lot of meetings, trying to keep up with everything that I do on a daily basis, and not to mention, I'm doing things that have got my my plate very full. So for some of you that do know that pay attention to the Facebook page, I am in the process of I'm trying to draft up a book, and that book is going to be a unique uh, experience. I guess we could say that for some of you, if you dare to get a copy. And I'm not going to say purchase just yet because there's some other things working behind the scenes that a lot of you don't know about. Some of the stuff that I'm actually working on and trying to get, man, I'm trying to get done in all the time frames that I'm trying to get done. But just know this: everything that I am doing, I'm trying to bring what I do to you for free. I'm trying to keep it free, and I'm trying to make sure that it never becomes an issue of funds or money or anything like that. Because one, I love what I do, and I think there's a big need for it out there, um, for all of you that listen to the show, and for all the amputees across the world to be able to have a talk show, a podcast that addresses issues relevant to them, and for the magazine to be free. And I'm not just talking about on the internet, I'm talking about a printed copy sent out to every person that subscribes to the magazine. Those are things that I'm trying to work on. So bear with me because it's a lot of work and it's a lot of thought that goes into that. And sometimes I get tied up in meetings or I just get swamped. And there's only one of me. And yes, I do work a full time job while I do all of my my charity work for you guys. So I wanted to make sure I had some time to come on and explain that to you today and try and clear up some things because you don't see me as active on Facebook. And the reason you don't see me as active on Facebook is because typically when I get up early in the morning, I'm up and I'm writing. I'm putting my thoughts down and doing research for the book. And then I'm trying to do stuff for the magazine. As you can tell, I got swamped and sidelined because we're behind a little bit, not too far behind. I'll have the next issue February up and out before you know it. Probably in about 2 weeks, I'll have that up and draft it and correct it and all the stories in. And again, guys, don't think I forgot. The cover challenge is still out there. I encourage all of you to come up with a cover and a backstory to your picture and claim yourself to be the cover for ampnationmagazine.com. So that's still going on, and I wanted you guys to know that. Now, that's kind of the housekeeping that I can talk about because there's some things I just can't talk to you about right now because they're in the works and I don't want to talk about them before they actually get done. And pardon me, all of you YouTube people and those of you on the talk show, I'm thirsty. So if I'm going to drink some water here, keep my mouth wet so I can keep talking. So I do beg your pardons there. But yes, and for those of you that don't realize, this is a live stream show. I don't do pre recorded stuff unless I have to. And I'm going to keep that type of format no matter how big we get and no matter what we do. This is always going to be something that's brought to you live unless we have to pre record a show due to time constraints for a guest. Now, that all of that's out of the way. I appreciate each and every one of you. Thanks, guys, for tuning in to Amp Life Talk Radio, and welcome to Amp Life Talk Radio, the podcast. If this is your first time listening, keep in mind if you want to be in tune with the show, you can go over to YouTube and punch in Amp Life Talk Radio, see us live in the studio doing what we're doing. It's not a big deal. It's just me sitting here at the mic, and you'll see all my stuff behind me, my little brick wall. Um, but that will be changing soon. There'll be some big things coming up. But I want to welcome everyone, new and old, to the show. Season 4, Episode 6, a guide to below knee amputations. And the reason I came up with this show is because we have booklets about this for my job that I give out to amputees. But a lot of times uh, I know a lot of people, if I don't have a booklet, and I direct a lot of people to my podcast channel, I thought it was just time to really put a good show together that is kind of an introduction to below knee amputations. Whether you're a new amputee or whether you're facing an amputation below the knee, I wanted to put together a show that would kind of encompass how uh, or what happens when I meet a person who's about to go through a below the knee amputation or someone who I've met that is currently new to it. They're in the hospital and I'm doing a peer visit with them. So this show is going to be kind of the book coming to life. Me in your room with you, talking through the microphone, handling this topic for you and your family. I've been getting a lot of those of late. So I decided tonight, why not do a show focused specifically on that? So if you happen to be somewhere and you don't get one of my handy dandy little books, you can actually just tune in right here and get this talk for new amputees, a guide to below uh, knee amputations. Now, I want to say living with limb loss can be challenging. You have questions, concerns, and you can feel alone during this process. While I'm Sean Harrison, I'm your guide here on Amp Life Talk Radio. I'm a certified peer visitor, both through Amputee Coalition of America and Ampower, two of the biggest uh, amputee support networks out there. And I'm the host of this show. I will be your guide as you go through this process of limb loss, amputation, having someone along with you as a guide as you become acquainted with living with limb loss is why I'm here. Empowering amputees to reach their full potential through communication, education, and information, and to inspire you. Amp Life Talk Radio is a talk show for amputees and those affected by limb loss and limb difference. If you're an amputee, I want you to know you're not alone. There are nearly 30 to 40,000 amputations performed in the US annually. And that number could be more since the research that I've looked up. And about 1.8 million Americans are living with amputations. The most common amputations are below the knee amputations, of which 23% of are lower limb amputations. Individuals aged 65 and above are the main recipients of a below the knee amputation. That's not including traumas. When you think about those numbers, that's kind of staggering. How many people are going through amputations daily, weekly, monthly, yearly? Segment one, we're going to get into talking about amputations. Segment one, amputations are a life changing event. I think it's important for every person to understand that has been faced with this choice, amputation. The goal of the below knee amputation and what it is to remove an unhealthy or damaged tissue limb and make the remaining leg or limb more useful and less painful. It is a tough decision for most doctors. It is a decision that most patients don't want to even think about. They don't want to hear that information coming from their doctor. Most people don't even know how to deal with that. Keep in mind, it is a reconstruction surgery and aims to bring the patient back to a normal life. I think that's what most people don't realize when they hear amputation in their future. It is a reconstructive procedure. And I must say, it's hard to say this if you have the right doctor. There's no other way to say it. I've seen a lot of amputations, some good, some bad. Amputation is a reconstructive surgery or procedure, and it is aimed at bringing the patient back to a normal life because we want to prepare that limb for a prosthetic device. A below the knee amputation is usually performed for ankle and foot issues. After a below the knee amputation, the patient gets a prosthetic leg, not immediately after. So we want to make sure we're clarifying some of these things. I'm not going to hit a lot of time frames. I'm going to deal with some time frames, but general, just so that you understand. Typically, after your amputation and you're healed and you're ready, the patient will get a prosthetic leg that allows them to walk. Keep in mind, every patient is different. Everybody's ability is different. Everybody's situation is going to be different. I see a lot of information, a lot of bad information being thrown around on social media sites that call themselves support groups. Unfortunately, some of these support groups, it's tough because you have a lot of bitter people in those support groups, and you have a lot of people that are disseminating bad information. Yes, the patient gets a prosthetic leg that will allow them to walk. But keep in mind, everyone's different. I see so many people asking questions. How long did it take you to walk? How long did it take you to do this? How long did it take you to heal? How long? Everyone is different depending on their circumstances. Now, advances in technology have made the recovery and rehabilitation phase much easier and faster for patients that, uh, let's see, um, as they can now lead a very active, relatively pain free life, relatively, keyword, following their amputation surgery. The procedure is performed between the knee and the ankle. How far they go up towards the knee really depends on tissue, bone, because infection can get into the bone and the tissue. Most doctors are going to want to move well above any type of damaged tissue or bone to give you the best prognosis for getting into some type of device and not having a reoccurrence of any type of infection. How long your limb will be is really determined on those factors. The procedure is performed between, keep in mind, the knee and the ankle. The amputation provides or can provide good results for people with injuries and certain diseases. Again, every one is different depending on why they're coming in, trauma, disease related. Everybody's different. How far along the infection is, a lot of different factors to take into consideration. Causes and circumstances in which a below the knee amputation is needed. This one is probably the biggest one that I get when I'm doing a pre amputation consult with my physicians. Pardon me, taking another drink. A below the knee amputation is performed if the patient is suffering from severe or chronic pain, or if the foot or the lower extremity of the patient has been severely injured in a traumatic incident. While there are many reasons that a below the knee amputation may be required by the patient, listed below are common reasons and conditions and problems. Let's go through those. And so you guys know, in ampnationmagazine.com, I tried to put show notes in the back of the magazine. So when I talk like this, trust me, you'll have an opportunity to see what I see when I'm reading off my screen, the actual research and the notes that I did for the show. For those of you that just want to have something more tangible, let's go into these reasons and conditions and problems. Trauma is probably one of the uh, reasons that the length of a limb can be seriously affected. A serious and severe injury to or in the lower limb area caused as a result of a vehicle accident, gunshot, I've seen them all, burns, all kinds of stuff. And Siri's trying to talk to me over here. I don't know why she's trying to talk to me, but somehow she just she turns herself on and wants to have a conversation. So I'm gonna actually stick her in my leg because I have my leg off, guys. Yes, I'm doing a show with no leg on. It's easier for me to fit under my desk. But I got to get rid of Siri. She's trying to tune in on my show. She's trying to jump in, get her little 2 cents in here. Get to the back. Um, Pain, or if the foot or the lower extremity of the patient has been severely injured. Remember, we're talking about a trauma. Trauma is something that definitely is probably one of the toughest things to do when we're talking about a guide to below the knee. Because the reason that's hard is because you can be in a traumatic accident or injury and you're rushed right into the ER and they may amputate your limb without you even having an opportunity to discuss that. That's why traumas are pretty tough, but it is one of the circumstances in which a below the knee amputation is or are required. Diabetes. Diabetes, we all know, is probably one of the number one causes of lower extremity amputations. People suffer from diabetes, often face a condition called peripheral vascular disease, which leads to the narrowing of arteries, leading to poor blood circulation. I saw a guy the other day in one of my clinics, and he has this going on, and the wound is not healing, but he does not want to succumb to or even think about losing his limb, despite the doctor telling him that he's going to lose the limb. I met with him briefly and tried to address some of his fears, and it's a tough topic to have, and he's trying to continue moving around on a injured limb, and he's probably just going to make it worse. He's already going to be at above the knee, and I tried to have a conversation with him about the sooner you can do this, the better off, because there are people who prolong this and it ends up being a hip dysortic, meaning you're amputated right at your hip. Those are really tough amputations to one, get prosthetics for, two, to actually recover from, depending on your age and what's going on with you health wise. This results in the poor circulation to the lower extremity or the extremity itself, and insufficient supply of oxygen and nutrients to the parts from the bloodstream. As a result, tissues in these parts of the body begin to deteriorate, which calls for amputation to relieve the pain and to make the affected parts less painful, more useful to you. This is the leading cause of below knee amputations in the world: diabetes. Cancer is third on our list. Another reason a below the knee amputation may be performed is the presence of untreatable tumors in the muscle and bones in the lower limb area of the body. Next on our list is infections. Removal of a limb may be required if there are infections untreatable in the lower limb areas. And last but not least, congenital amputations, limb deficiencies. This is a condition when the limb fails to develop or form completely. It is common, and it is a common reason for below the knee amputations as well as above among small children. Complex regional pain syndrome. How many of you have actually heard about that? Show of hands, anyone? This is a condition with chronic pain in the limb caused as a result of a traumatic injury or trauma to the limb. CRPS is also thought to be caused due to complex regional pain syndrome, CRPS, thought to be caused due to damage or malfunctions of the central or peripheral nervous system. So, guys, these are some of the causes and uh, things that basically happen if you find yourself being treated by a doctor and he mentions one of these to you and it's not getting better. Amputation below the knee may be in your future. Segment two, I want to get into talking about a below the knee amputation as a serious and complex surgery that aims to address the issues in the areas below the knee. A decision to carry out an amputation should be made keeping in mind all the factors into account after thorough discussion between the team of doctors, the patient family, as the decision is going to affect the rest of the patient's life. All those things we just discussed above should be properly discussed between your healthcare team, your family, and yourself. People that are going to be supporting you after you come out of surgery. All these people need to be involved with this decision. And if you're lucky enough to be able to have someone like myself, a certified peer counselor or visitor, to come and talk to you as a fellow amputee and be able to explain outcomes, um, and what to expect after surgery, working with your surgeon, getting the best prognosis, working with the practitioners, the person who's going to actually build your leg, everybody having all eyes and hands on deck in making sure you're going to have the best outcome. And we're all thinking about that. Preparing for a below knee amputation. And that's a good question. How do you prepare for a below the knee amputation surgery? Well, one of the things that I do is I meet with my patients once they're brought to my attention by a surgeon or a medical professional. I typically like to meet with my patients actually before the surgery. I'm part of the pre consultation group. We all sit, we talk, we round table the subject and try and make sure the patient has the proper and right information to make a good decision. I do not make decisions for patients to amputate. I want to make sure that's clear. I do not make that decision. I provide information. We talk about quality of life, preparing for a below the knee amputation surgery. We need to talk about why it's needed. Typically, improving the quality of life of the patient is the main reason to perform a below the knee amputation. And when we talk about that, it's hard for some new amputee to understand that this will actually improve their life. Things could and can be better with an amputation. That's a tough pill to swallow when you're facing this. The patient needs to prepare themselves for the surgery, both mentally, emotionally, and physically. And a number of things can be done to facilitate the transition of the patient from a painful and dependent life to hopefully a pain-free life, independent life post surgery. Well, here are some things that can help the patient prepare for the life changing surgery. Remember, this is a guide to below the knee amputations that I'm trying to do for those of you that are expecting an amputation, those of you that have recently had one. This is a guide for you and your family. What to expect. It is important to talk to your doctors, your healthcare team about what to expect after the surgery and from a rehabilitation standpoint. Discuss all the important aspects of surgery and what to expect after it from your orthopedic surgeon, primary care physician, your prosthetist, your rehabilitation team, and your physical therapist. If you are lucky enough to have communications with these people, I highly recommend you talk with someone. You know you're going to go into a surgery for an amputation. Already meet with whatever skilled nursing facility that you're going to go into and discuss with them what their plans are for you when you come out as a below the knee amputee. What are their plans for physical therapy? Meet with a practitioner, a prosthetist, a person who's going to build your prosthetic limb. Have this information handy. It will help you adjust and deal with this way much better than going into it not knowing. Meet with someone like myself, a peer visitor, counselor, a fellow amputee who's been trained in how to help you through this process. Don't just grab any amputee off the road. Yes, every amputee has experience in limb loss, but having that additional training on how to listen, how to find resources, and how to really emotionally connect and help someone as a mentor is crucial. You can also discuss the surgery with someone who has undergone a similar operation before. That's also useful. You will get some useful insight. It is better to find an amputee who is trained and is someone who has been through what you're going through to ask them questions, tips, information, guidance through this whole process. Also, look for a support group. And support groups are going to be one of my topics I'm going to talk about because there is a big difference between support groups and social groups. That's a whole nother show we'll get into. This will help you get the emotional and psychological help that you may need. While you are at it, also consider the changes you will have to make in your home. A lot of people don't think about that. A ramp, handrails, shower chair, crutches, lighting along the walkway, pathways in your home. Ask your doctor if he will confine or confirm through an order for you to be able to get a wheelchair. Some people need electric wheelchairs. These changes can make all the difference in your post surgery life more comfortable when you return home. A big one that I'm definitely a big advocate on is stay healthy. When you know that amputation is in your future and your doctor talks to you, do everything you can to stay healthy. Start eating right, taking vitamins, supplements, drinking plenty of water if you're not a diabetic, because I know diabetics have to watch their fluid intake. But do all the little things that you need to do to be prepared for that surgery will help lead to a better outcome once you go through the surgery. It is important to keep yourself healthy and strong. You should aim to maintain the muscle strength and fitness level that you had before surgery. You will be prescribed some strength uh, training exercises by your physical therapy team to keep your muscles strong. You can also be prescribed some of these by your doctor before the surgery, especially if you know you're not going to do this for a couple of months. Do things to prepare yourself. Practice on a scooter, practice on crutches, practice on a walker. Use this time prior to surgery to get familiar with these items because you will be using them more than likely after the surgery. Keep in mind, it may take some time to learn how to balance yourself, but you will get used to it with practice. Who is the below the knee amputation surgery right for? A lot of people, when they hear this information and they're told this, they just can't believe the doctor is telling them, I have to have this surgery. Nobody wants to hear that. But who is the below the knee amputation surgery right for? Right for? Well, let's discuss that. Typically, people suffering from traumatic injury or severe pain in the lower leg can opt for a below the knee amputation. I know there are doctors out there who will fight with you. They don't want to do the amputation, they just want to keep operating. Find an advocate to speak on your behalf to your doctor. I was going to call out a hospital, but I'm not going to do that. Some healthcare providers are sticklers about this and they just don't want to do it. Get an advocate to, fight for your behalf, man. That's the best thing I can say in those situations. Um, there are many who don't qualify for surgery when we talk about amputations, and there are some that do. So make sure you have an advocate and a good understanding of your condition and if an amputation, a below the knee amputation, will make things better for you. If you do not have proper blood circulation, as we mentioned above in your body, a proper elevation before the surgery will be needed, as the natural healing process of the body requires good blood flow. Having knowledge about the exact location of the tissue is very important if the below the knee amputation is conducted because of a tumor or infection. Infections can affect the length of the limb that is left. If they if they are found above the knee as well, you might need a higher level of amputation than just the below the knee. So please listen to what your doctor says. Please don't delay if you hear you do have some type of infection, because infections move throughout the body and in the bone very fast. So if your doctor is mentioning this to you when we talk about who is the below the knee amputation surgery right for, if your doctor is having this conversation with you and the words tumor or infection are involved, you are on a tight time frame, and making this decision in a proper amount of time is probably going to determine how much limb length you have left. Being below the knee is probably one of the better options for being an amputee, as you only lose one joint. Going above the knee means you lose two joints, which means yes, it can be tough to ambulate and walk, but it's not impossible. It is important for the below the knee amputee to have sufficient skin, as they will have to build you a pad from your skin and muscles. All these things are going to need to heal and provide a great surface for your prosthetic device. Keep in mind, again, it is important for the below the knee amputee to have sufficient skin and muscle to heal the wound. Muscle loss can scar, or muscle loss and scar tissue can affect the healing process. That is very, very important to know. Muscle loss and scar tissue can affect the healing process. Now, the procedure itself, a below the knee amputation lasts between 2 and 3 hours. After the patient is put to sleep, the anesthesiologist, and we'll say by the anesthesiologist, your incision line is made on the place of the amputation and calf muscle. Skin are cut away, all these things, leaving a flap to later cover the residual bone, which, remember, this is a constructive procedure. Your bone should be shaped and rounded off so that it does not protrude or poke or cause pain as you heal. This is the common procedure of doing the surgery. The patient stays in the hospital. Your ranges can be from 1 night to 2 weeks, depending on the conditions of the wound and the speed of recovery. Do not be shocked if, for some weird reason, they tell you they're going to leave it open while they determine if there's more infection that they may have to go back in and remove. That is a common practice when you're dealing with infection. Once the patient is able to move using a walker, scooter, or crutches, take yourself from the toilet to your wheelchair, doing transfers, and to the bed to the wheelchair, you're going to be pretty much released or discharged from the hospital. The same goes for a skilled nursing facility. Once you complete your therapy and you show that you can do the things on your therapy list or your therapy plan safely, it is time for you to move towards your home. During all this time, work with your family member, social worker, caseworker to bring your house up to speed and compliance with you, as you're going to return home and you're going to need certain things changed to help you move around your house. Now, please be advised there can be complications. Atrophy, losing muscle strength because of not using an affected limb. Your limb has been amputated. It's going to take a while before you get that limb moving. That's why most places will try to get you up and moving and doing physical therapy immediately after your amputation surgery. Do not be shocked. I want to make sure you understand that atrophy is something that they want to prevent, the loss of muscle strength. Phantom limb pain. You will feel this, my friends. A shooting pain felt in the areas of the amputated limb, shocking, burning, twitching. It happens. Your nerves have been severed. Contracture. If you're going to be sitting in a wheelchair, do everything you can to keep the residual limb, which is your amputated limb, straight. Tightness of the muscle and joints due to lack of movement. If you're sitting around, which you can be sitting around for some time as you heal, make sure you don't get contracture. There are things out there like the AmpuShield that you can be placed in from a prosthetic provider that will help work with your limb to keep it straight. Bone spur overgrowth, formations of an undesired bone at the base of the residual limb, affecting the ability to wear a prosthetic device. This is something that if you notice that you're having pain in the residual limb at the distal or lower end, talk with your doctor. Really quick. Hey Brian, I hope you guys can hear me on YouTube over there. Hi Brian. He says he gets it every day. Phantom pain. I think that's what you're talking about. Brian, you need to listen to the show and hear all the things that are coming, just so you know, Brian. Um, I'll reach out to you too as these things start to come to tuition. um, the recovery and rehabilitation post surgery. Very, very important stage for you new amputees as you look to gain your life back. The speed of recovery of which a patient is different for everyone. Your your speed of recovery for each one of you out there that are new amputees, those of you that are about to face an amputation, it's going to be different. I want to answer this question because I see it so much on Facebook. It's different for everybody. It really depends on their overall health and age and everything else that's going on with you. In the first few days of the surgery or first few days of the surgery, the patient will be made to do some stretching and some motion exercises. So when you come out post surgery, they're going to make you do some things. Like I told you, they're going to come get you within a day right after your surgery, and they're going to start working with you to start getting you rehabilitated so you can get back up on your feet. Remember, don't fight them. Work with them because they are trying to do what they can to help you get back up on your feet. Your rehabilitation team is not there to just bug you. It's not like they don't have anything else to do. They have a very specific role in your care. Work with your rehabilitation team. You, as the patient, will also be assisted in learning some basic actions like rolling in bed, sitting on the side of the bed, and moving to a chair. I told you, transfer chair, wheelchair to chair, wheelchair to toilet, wheelchair to tub. These are things that they're going to be working with you on. Transferring into your car and out of your car, typically using a slide board if possible. All these things are important to be very careful while you're doing them in the recovery phase, as even a small bump can lead to an opening in the incision line, and this will delay your recovery process and also give uh, birth to the need of performing additional surgeries. Don't fall on your stump. Take your time getting up out of bed and realize that you don't have a foot. A lot of amputees wake up groggy, you're on medication, you've been sleeping, you have to go to the bathroom, you get up and you feel the sensation of your foot there, and you'll try to take a step. Take a moment, pause, take a moment. Don't wait to the last minute to try and use the bathroom from your bed or from your wheelchair. This is when you start to rush, and by rushing, you will fall. The bathroom is the number one place that amputees take a spill and fall. And trust me, brothers and sisters, if you fall and hit your residual limb, it is a sweet Jesus moment. Those of you out there that have done it, you know what I'm talking about. It is not a good feeling at all. And for those of you that have managed to not do that and keep your limb intact and not fall, I applaud you. Good job, because you probably went through all of this without having any setbacks or going in for a revision to have that limb looked at again or operated on. Remember, guys, it is so important to listen to this part of this talk. Slow down, take your time, listen to your physical therapy team. It is important to monitor your physical, emotional, and psychological well-being during this time immediately after surgery. You will have to take some major changes and make some major changes to your lifestyle, but you will gain independence in some time, and this can lead to a routine life again. You're going to learn some new habits. It's going to be frustrating. It's going to get to you. Just keep everything in check. You will get back up with the proper motivation, taking care of yourselves. You can get back to a normal life. Maintaining your muscle strength is very important, as we said, for a speedy recovery. This is why it is so important to work with your rehabilitation team after a below the knee amputation surgery has been performed. While prosthetics is some way a little bit ways down the road, prosthetics are very important and necessary for normal function after the surgery, after rehabilitation, and after healing. You cannot wear your prosthetic device all the time. So there's some things we need to understand. For example, when you are relaxing at home, at the end of the day, taking a shower or doing something that might damage or stain the prosthetic limb, here are some solutions to solve the issue of wearing your prosthetic device all the time. Keep in mind, I wear mine pretty much all the time. Everybody's different. I don't suggest, and what we mean by staying, showering. You can't shower with the limb on. Okay. You can, but then it requires maintenance afterwards. So getting the leg wet is probably not the best practices. Sleeping, taking long naps. It's pretty painful to sit for long periods of time with the leg on. I take mine off, like I'm doing right now. I'm sitting here doing my show, and I will just show you guys. So those of you that are on TV, so see, I have my leg off. I took everything off because I just spent a long day at work and I wanted to take my leg off while I did my show. So I'm wearing flip flops and I'm just sitting here talking to you, and I took my leg off. So there are times when you'll want to take it off. There's times when you'll want to leave it on. And when you do that, a wheelchair, arm crutches, knee scooter, any of those things come in handy. Okay. Um, be careful when you're in that state. Always try to wear either your liner or some type of protector if you're going to be moving around the house without your prosthetic limb on. I guess I better answer this because I know it's very obvious to myself, but to some of you, you cannot sleep with your prosthetic device on. I'm just going to put that out there. Okay. Below the knee amputation is a life changing surgery, and the outcomes are more positive than negative. I want everyone to understand that. A below the knee amputation results in a pain free and more useful life than before. Work with your practitioner to find the proper fitting, comfortable socket. Know about your liners and your socks and cleaning them. Well, I've done shows on those. Listen to some of my other shows that talk about cleaning your liners, sock usage, and those different topics that you will face. You can also live a completely independent life post surgery thanks to the technology that goes into prosthetics and the devices like the knee scooter, arm crutches, wheelchairs, which all allow you to keep your mobility and move around, whether you're in or out of your prosthetic device. I want to say for the record, this information is informational purposes only. Please remember to consult with your doctor before you do anything. Boys and girls, I want to thank you guys for another opportunity to talk with you, for you guys to be a part of the show here at Amp Life Talk Radio, the podcast. You guys are awesome, man. And I am looking forward to doing some of the cool things that I have planned for you. Stay tuned. My apologies to those that I missed being able to have on the show last week. I'm really, really sorry. And I will make that up to you. And I want to say to you guys, um, be safe out there. If you do have a new amputation, be safe. Hopefully, this show meant something to you. You got something from it. If you know somebody that's about to become an amputee or they're considering it, please share this episode with them because I think they'll gain something from it. You guys are awesome. I'm your host, Sean Harrison here at Amp Life Talk Radio, the podcast. Look us up on Apple Podcasts, Spreaker, iHeartRadio, and Spotify. Remember, Amp Life Talk Radio on Spreaker, iHeart, Spotify, all those channels you can find us. The YouTube channel, if you go over and you see this video, give me a like, man. I need you guys to subscribe to my stuff. But seriously, I appreciate all of you, and I'm so thankful for you guys tuning in and listening to me. For those of you in the Central Valley, I'm doing a limb loss awareness event here in the Central Valley. If you live in Stockton, Merced, Turlock, Modesto, Ceres, Oakdale, Tracy, all the way down to Visalia. Look for one of our flyers. You'll see it on my Facebook page. Check it out. It's April 18th, 2020. April 18th, 2020 at Encompass Health in Modesto, California. Limb loss awareness event. We're putting that on, and I hope that you guys will get there, be there. We're going to have some cool things going on. It's going to be a fun information education day. Get out there. And for those people that are concerned, you don't have to run. It's a fun walk or run. If you want to run, you can run. If you want to walk, you can walk. It's a stroll in the park. So check it out. Look for one of the flyers. If you want flyers to put up at your business, get at me. Send me a message and I'll bring some by to you. Again, everyone, thanks again for tuning in to Amp Life Talk Radio. I'm your host, Sean Harrison. Have yourself a wonderful night.
You are listening to Sean. Guests are their own. Always seek medical advice from a licensed medical professional.